Alright, so if we summarize the political factor, how do we say it in short?
Nobody's collaborating.
When we need collaboration, nobody's actually collaborating. So one generation, let's say somebody lives for an average of 70 years. So two generations, that means we can adjust for about 140 years.
Something like that.
So the summary from the health shock is this is going to be long term.
And we as global citizens need to be pandemic savvy, according to Dr. Goldman. But it was actually 1,000 years ago when we had the Black Death or the bubonic plague spread from China to Europe and the Arab world that we had a similar type of danger.
1,000 years ago. But you also said China. Why China? Bismillahirrahmanirrahim. Assalamualaikum and a very good day, everybody. Welcome to Shape discussion series on COVID-19, shock and faith for Islamic finance. I'm Shabnam Mokhtar. I'm the moderator from Shape Knowledge Services, and the speaker for today is Mr. Abdul Qadir Thomas, our group CEO. So, Mr. Abdul Qadir, what are we going to discuss in this series?
Assalamu alaikum and good morning, everybody. The key thing that we're going to look at today is first, what sort of situation has been created by COVID and how much it's linking on to other situations, and then how that is going to impact or is currently impacting our economies, and what sort of things we might look forward to in the future.
So we have a few segments in this series. We will start with setting up the context for the discussion.
Correct.
So in this segment, we'll be looking at what exactly?
We're going to be looking at two things, really. We're going to be looking at the geopolitical context and the epidemiological context.
What does that mean in simple English?
That means that there's politics which have been going on before COVID-19 that are affecting how people are behaving today, and separately, there's how diseases behave that we need to understand better in order to realize that we're not in a short-term situation.
So that's basically the shock, the political factors and the health factor.
Exactly.
Right. Once we've done that, we will go to the next segment. We're going to spend some time looking at from these shocks, there'll be impact on the economic changes as well as the social changes.
Exactly.
And how that's going to affect finance going forward.
Exactly.
Following that, we will be looking at, so the two main implications coming out of the structural changes is going to be the more and more demand for ESG and social banking.
Yes, indeed.
And the next bit will be?
A much higher reliance on e-everything.
So e-everything. So let's start the first segment. So the first shock, we will be looking at the political factors.
But let's think about it in a different way. In the past, we as human beings were pretty good at letting health overcome politics. And a good example of that is during the 1957 flu pandemic, the People's Republic of China, which had no relationship with the United States, and the United States began informal collaboration to check out the risk of flu pandemics starting again in South China and spreading globally.
So what did they do in this informal collaboration?
They exchanged research scientists, they set up testing stations, they shared data from those testing stations to make sure that people would know whether there was a serious flu or a not very dangerous flu coming out of South China and how fast it was spreading and what its factors were.
Even when China was not yet an open economy, health prevailed compared to the political factors.
And they could have been selfish, but they weren't because they had already seen the problem, but they're actually helping the rest of the world to see it and react correctly.
And what happened next?
Well, it took a bit of time, but in 2004, after the SARS outbreak, the People's Republic of China and the United States began formal testing and collaboration in antiviral areas, looking at things like SARS and similar types of diseases that come out of unknown areas, that might come out of wet markets, might come out of travel behavior. And
so how is the formal collaboration different from the informal collaboration in the early 60s?
They're exchanging scientists, they're spending money in each other's country, they're formalizing research on particular topics and directing money and human resources into those areas for the protection of humanity from disease.
So is that still continuing until today?
No.
What happened?
strangely, before we all knew what COVID-19 was going to be, President Trump decided that the collaboration was not worth the money and canceled the U.S. share of funding. And so that began unwinding just as COVID was becoming dangerous.
Wow. No better timing, huh?
I tell you.
So that's the relationship between China and the US. From informal before the market opened up to formal collaboration, but unfortunately ended in January this year.
And so the trend on the political is now to see unraveling.
Okay. What's happening in Europe?
Unraveling.
Unraveling, okay.
And the EU has been really, really good at a large number of collaborations, becoming a bit state-like, especially on the economy and especially in criminal law. And maybe that's why Britain voted for Brexit, feeling that it was less independent than it had ever been. But all of that very good collaboration broke down first when Italy was the first EU country to be badly hit by COVID and Spain was the second. And what became a serious reality was that Northern Europe started hoarding resources, preventing travel and exchanges with Southern Europe. So as COVID was a threat of increasing danger in Italy, losing a huge number of lives, instead of sending supplies and medical resource and human resource, Germany and France closed their borders and were hoarding resources.
But could one argue that the EU is an economic collaboration, not a health collaboration? Is that fair to say?
No, I think it's not fair to say. I think the EU is everything short of a government, meaning that it's been very good at collaboration in economy, in law, and in health.
Except when this hit, everybody started focusing on themselves.
Exactly.
All right, so there's chaos in Europe as well.
Although that's become better now. The Northern Europeans have begun behaving collaborative with the Southern Europeans, and there's help now coming. The worst of the crisis is over, but now there's the financial help to resolve what the damage done.
What about the international bodies like UNICEF or WHO?
Well,
like the United Nations and WHO.
Well, unfortunately, the politics of the U.S.-China trade situation, the U.S.-Russia geopolitical relationships, has infected the United Nations so that on these health matters, which should be paramount and which they collaborated on very well in the past, are no longer being treated as the top priorities. And this has come out with the American accusations first against the WHO as being, they accused it of being a stooge of China.
Oh, why was that?
They felt that WHO should have known faster and better what was happening in China and should not have taken China's word for what was happening. And that's now led to the United States withdrawing from WHO.
Oh.
And the problem with this, of course, is not the US-China spat, which is bad by itself. It's actually that it affects all the other countries that need WHO's expertise and funding for WHO to prevent COVID-19 from getting worse or spreading in their countries.
All right. So if we summarize the political factor, how do we say it in short?
Nobody's collaborating.
When we need collaboration, nobody's actually collaborating. So that's the first shock. Now let's look at the health shock.
Indeed.
What's happening?
So I think one of the things that we need to really grasp is we don't know.
So we should acknowledge that we do not know.
Correct.
Okay.
Some of the things that we know are that the mortality rates of COVID-19 are very high. The morbidity is very high, meaning how it can spread easily from person to person. And then the number of people who died. So it's not just another flu, it's something more serious. But we don't yet know exactly how because the data from different countries is actually very, very different. And then we don't know if it's going to be like a soliton wave with equal troughs and peaks over an extended period of time. And the New York Times published a summary of scientific research a few weeks back in which they pointed out that until there's a vaccine, we need to be prepared for 18 to 24 months of wave-like activity. It comes and it goes and it comes and it goes.
So the ups and downs
Exactly.
cases. Okay. So that's going to be at least 2 years.
And they're presuming that there'll be a vaccine.
Okay.
The United Kingdom has published a very interesting piece saying, look, we need to be ready for long-term periodic epidemics. And what's different here from the New York Times is they're not limiting it to COVID-19.
So there could be other pandemics.
Exactly.
And what would cause this?
Well, it could be the same thing. Another crossing of infection between animals in a wet market in Africa and China and South America. It could be thawing of permafrost in Canada or Alaska or Russia.
So global warming could release unknown viruses
in places where they've been frozen for thousands of years.
Okay. And who's Mr. Goldman?
Dr. Michel Goldman is an expert in immunology, but what he's done is he's come up with a very, very clear understanding of how we need to behave. And even though he likes to say that the science we have is good, it's capable, and we can overcome things, he's saying we've got to think about 1 or 2 generations behaving differently than we've been behaving the last few.
1 or 2 generation. So what does that mean?
It means we have to start reorganizing our lives differently. Social distancing, in his mind, is going to become a fact.
So 1 generation, let's say somebody lives for an average of 70 years. So 2 generations, that means we can adjust for about 140 years.
Something like that.
So the summary from the health shock is this is going to be long term.
And we as global citizens need to be pandemic savvy, according to Dr. Goldman.
Mr. Abdul Qadir is a history geek. So I got to ask you this. When did we last have a pandemic like this?
So we have pandemics all the time. They just aren't always this dangerous.
Okay.
So then we did have a flu pandemic in 1957 and 1969, but not with the type of spread and subsequent mortality that COVID-19 has had. And we've had cholera and other things in the more recent past. But it was actually 1,000 years ago when we had the Black Death or the bubonic plague spread from China to Europe and the Arab world that we had a similar type of danger.
1,000 years ago, but you also say China. Why China?
So China has historically been one of the most highly populated countries with densely populated cities. So if something goes wrong in a densely populated area, you have high risk of, if something goes wrong with health or sanitation, you have a risk of that spreading. If that is a connected city, remember China, 1,000 years ago, 100 years ago, China was the starting point of the Silk Road. So the vectors of disease moved on fleas, on rats, on camels, on horses from China to Central Asia to Europe and to the Middle East.
Interesting. So China has high density in population. It's also a global center, a trade center. So those are the factors that causes the spread very quickly.
Exactly. And there's another factor, which was the factor picked up in the flu pandemics going back to the 1950s. And that is that in many places in China, and South China is the place that we want to focus on for a minute, you have high density of human beings, high density animal domestication for food. So lots of pigs, lots of ducks, lots of geese, lots of chickens, densely living together with human beings on bird migratory routes.
Okay.
And most of our flu viruses actually come from wild birds transmitted first to domesticated birds and later to pigs or domesticated animals, but pigs are the most common for that transmission, and on to us.
So, strategic location with multi-sources of infection.
Exactly.
Right. So if we summarize it, 2 factors. Political, nobody's collaborating. On the health side, we only saw a pandemic of this magnitude 1,000 years ago, and it's here for a long term.
Exactly. And even 1,000 years ago, it was something that lasted. It wasn't something that went away instantaneously.
All right. So that wraps up the first segment. Now let's move on to the second segment.